Alrighty, our agenda this morning, we have a couple quick announcements. I'm going to do a very brief COVID update, and then one of our epidemiologists, Mariana, is on the call this morning. She's going to talk a little bit about where we are with monkeypox in our community. The two announcements I wanted to share on behalf of our friends at the U of A. They wanted me to share that they're recruiting for a flu study, and they wanted to extend this opportunity to any school nurses, school staff to participate. They're not asking schools to recruit on their behalf, but it's an opportunity for any of you to participate in the study, and they are compensating up to $195. I looked into it. It looks like a pretty low commitment. You agree to get a flu shot like you normally would, and then answer a few questions. We'll be including the flyer and more information in our follow-up email. Also, just to put on your radar, we have some new resources we're putting together specific to COVID vaccines. We're looking to support schools however we can in boosting their vaccine rates, whether that's talking with parents who might be hesitant or talking with students themselves, or even the staff at your school. We're going to go ahead and put some resources together for you to help with that. I'm going to go ahead and mute. We're also looking into better ways to educate on monkeypox. And so the CDC has put out some guidance for young people and adolescents. And so we're looking at the health department on how we can better link young people to those resources. So you might see a flyer to come out in the upcoming weeks to help link the young people at your schools to those resources, just to help educate them in what monkeypox is, how it's spread, how to avoid it. All right, let's talk about COVID very briefly. We are still low in the county, which is great. Although we are still at a high rate of transmission, we did see a pretty significant dip in our case rates last week. So it went down more than 50%. And I did reach out to our epidemiology team to ask if they have any indication why we saw that significant drop. And they were going to look into that. So maybe more information to come on that. But I'll take it. That's good news. We like to see our case rates dropping. Vaccines, we're probably going to be presenting a little bit differently moving forward now that these new boosters are available. For now, in terms of those 5 and up who've received their first booster, we're sitting around 50% and would love to see that number go up. As always, if you'd like to see the most up-to-date information, the CDC should be updating this later this afternoon. You're welcome to check out their website. A little bit more information, as always, on our community levels. It's looking a lot better. Here's our map. Liking that big chunk of green over here on the western side of the country and in Arizona. We are still seeing red. You might notice there in Apache County. And then it looks like down in the southwestern corner of the state, La Paz and Yuma are still in medium transmission. So just keep that in mind if you're traveling to those areas. Our transmission map, not looking as nice as the previous map. We still got a lot of red going on. But if trends continue, hopefully, maybe next week, we'll turn orange at least. Resources for you. I updated this page. If you'd like to schedule a vaccine clinic for COVID-19 vaccines at your school, you can reach out to our vaccine equity team, and they have all of the different vaccines available for youth and adults. They are unable to do flu vaccines. So if you're looking to do a clinic that is providing flu and COVID-19 vaccines, they might continue to refer you to PMG. But if you just want to get a vaccine clinic scheduled, they'd be more than happy to work with you and set that up. Updated our links for our COVID-19 resources and our monkeypox resources, including that document we put together for schools for considerations on how to mitigate monkeypox. And then also the form to report case counts and outbreaks. We really appreciate the schools that are keeping the county informed. It helps us just track kind of our local status. You have any questions or need to reach out to us, there's our web address, our phone number, our school support email. School support email is probably the fastest and best way to get a hold of us, but you're welcome to give us a call if you'd prefer. And that's actually all I have, short and sweet today, but Mariana is on the phone. I'm going to turn it over to her to present a little bit more on monkeypox.
Hi, good morning. Let me begin trying to share my this one. You should be looking at a slide that says monkeypox update.
Yes, we can see it.
Okay, so great. Good morning, all. This is just a minimum update. We have been lucky enough to not have any case of monkeypox in school age. And I just want to show you what is happening, and hopefully I will be able to do this every week. So, oops, I didn't want to go there. So this week in the epidemiological week, you're gonna always hear about that, Epi Week 37. And this goes from the past Sunday, 9/11, to this Saturday, 9/17. So far, we have had in the county 99 cases reported. For the epidemiologists, reported is anybody that goes and this looks like monkeypox. Maybe we should tell this the health department. So from those, we began investigation and we test, or the providers test, and we have 25 confirmed cases and 24 probable cases. That classification, it's more epidemiological. You're going to see everywhere that we have 49 cases of monkeypox in Pima County. Then the two suspected are two cases that we're still waiting for test results. So we think it is, but we're not sure. And then we have 48 people that has been tested because we thought it was, but the results were negative. So we are okay with that. And this is kind of what I'm going to be letting you know all the time. It's also what you can see in our monkeypox website. And Matthew had it on his resources. So almost there with 100. I need to tell you that this is awesome for a county our size, let's say, and also really good for comparing with other states, counties in the states, and for Arizona with other states. So this is what shows us all the cases that has been reported. You will see confirmed in red, yellow is probable, the suspected are blue, and the not a case are gray. And it kind of let us know when this began, the week 22nd, that was like June. And this gets the testing in the community. So the more we test, the more cases we're going to find. And you can see that week 32 was kind of the week that we have tested more, but for good, they were not actually all cases. So our epi curve, this is only all the cases. The next one is our epi curve. And this actually show us how things are going on the cases that we detect in the community. You can see that at least it looks like our peak of cases was on the week 32nd. So week 32nd is the beginning of August, was the beginning of August, and we are kind of going down. Now, the difference for people that are curious about it, the difference between probable and confirmed is only the kind of test that we can do at the state lab, and then we need to send to CDC to confirm the specific virus versus what the labs can do, and they can tell us, yes, this is monkeypox. Definitely, that is a confirmed. The probable is when we detect an orthopox, but an orthopox virus, this is the only one circulating, so we're almost 95% sure it is monkeypox, because the other option will be smallpox that we know we don't have. So that's the only difference. But all these cases has been seen, treated, and at some point we should have more. This will change and we will see more red, more confirmed, as long as CDC can process the samples. And so this is what we're seeing now. Definitely going down. Still a lot of tests. What is actually good for detecting cases, a good control. We have given away a lot of vaccines. Every Saturday we have, on the last month, we have had vaccination for people that are eligible. And the eligible people so far is still people that has a known exposure or a suspected exposure, confirmed exposure or suspected exposure, and also people that are in a high risk for getting the disease. And that is defined by more than one sexual partner that is male or born male in the last 2 weeks. And I will say that the news for this week, it's, as I said before at the beginning, no school-age monkeypox cases in Pima County, what is good. As an epi, I need to tell you, we have reports of isolated chickenpox cases. And I think it's very important to remind everybody that chickenpox is not the same that monkeypox. And because it ends in pox, it's pox only refers to the skin lesions, but at least the diseases or the viruses are not in the same family. So chickenpox is one family, the herpes virus family, and monkeypox is another family, the orthopox family. So those are good news. And maybe remind everybody that COVID cleaning measures are okay to prevent monkeypox. So this is the EPI team contact information, and I just PDF this short presentation and send it to Matt so he can add it to any news that he's going to send after this call. So I'm going to stop presenting so I can kind of check the chat if there are any question, anything that you want me to explain more. Anything in the chat? I haven't opened the chat. Oh, that is COVID, Matt. What is low for COVID positive cases yet high in transmission?
Actually, Mariana, I'm wondering if you
Yeah.
could help answer that question.
I will help with that one. It's not monkeypox, but that's okay. So the question says, I am sure this has been explained numerous times, so it doesn't matter. You can always ask questions. The teachers are the first one that said there's no bad question. So what is the difference between the county being in low for COVID positive cases, yet high in transmission? So at the beginning, we were counting exactly all the cases, but now we do not receive the report from all the cases mainly because of the at-home tests that we do not receive information about. So the transmission has been defined now different, and the transmission is more defined on about the amount of hospitalizations and the cases that we see. So there are different things going around that we can detect how active the disease is in the community, because the number of cases is not really what we have to give us the complete idea of what is happening, how active the disease is. And that's kind of the difference. The county being low in COVID positive number of cases, it could be because many people are testing at home, or it could be because people travel, tested in another state, came back, and then gave the COVID at home, let's say. So one person that got it in another place, then come back home and got everybody at home sick. And also in the transmission portion, we're really looking at the amount of hospitalizations, the ER consultations, and even the high risk and ICU, the ICU occupation, because the transmission also is more connected to how bad the disease is in the community more than the number. So I hope that will help.
That's how I understand it, just to kind of reiterate that the reason why we have a high transmission rate but a low community level is that transmission rate is pretty much based only on our case rate, whereas the community level also takes into account admissions into the hospital and the number of staffed beds. And so they're determined a little bit differently. And yes, COVID is still with us.
Maria, you're super right. And it will still be. If you hear the WHO news, we could be ending this, but it's not over yet. And the other thing that I bet everybody knows already, it's going to stay with us.
Any other questions that you might have or that maybe you've been hearing come up at your schools that you'd like to ask, especially now that we have Mariana with us today? If not, that's okay. You're always welcome to email your questions to schoolsupport@pima.gov. If those are questions I'm able to answer, I'll usually reply very quickly. And if it warrants a response from our epi team, then I'm always happy to connect schools with one of our epidemiologists. So I agree. Mariana is so awesome. Our epi team are like, they're like our varsity team here. They're all celebrities.
Yes. What are the big...
Good question. You take it.
Yes. So monkeypox, it is supposed, and I always said it is supposed because not everything we see the same things in the same way. Supposedly, the people that has monkeypox begins with a flu-like symptoms. You know, in epidemiology, you're going to hear that half of the things are flu-like symptoms, the other half is enteric, meaning flu-like symptoms is fever, respiratory issues, some headache. The enterics are the diarrhea, nausea, and vomit. So monkeypox begin with these flu-like symptoms like 3 to 5 days after the person has been exposed, and that lasts like 1 or 2 days. And then after that, there is a time, 1 or 2 days again, after a rash begins. And the rash, it's not the typical rash that we have seen in monkeypox that is like well-defined, very similar to smallpox. These cases or this virus mutated in Europe before coming here, and it's giving different kind of rashes. So what we see are lesions that can be a red spot that's called macular. It can be a papula that is a really small bump, but they are hard. They are not vesicles, and not with liquid. Vesicles are like blisters. Not everything comes out with liquid. Usually what you see is the papula, and then they go to a crust. And that can take from 2 to 4 weeks. So the evolution is really long of the disease. And during the time that anybody has a lesion that is, even with the crust, that has not fall out, they are contagious. That's kind of the most important thing in monkeypox. And the lesions can be, we have seen from 2, like this is weird, to many. Also because it's really pretty similar to the sexual transmission infections. The area where the rash presents, it's very important. And there are 2 main problems when the rash gets in around the mouth and in the pharynx, because those cases are really experiment a lot of pain, and they cannot even eat. The other problem is in the genital area, especially perianal, that can give a proctitis, and it's inside in the mucus on the rectum, and that is also really painful and limits the quality of life. So now at least we have medication to help with that, but it's extremely painful. I think I went off the beginning symptoms. I tell you about the whole disease. Sorry. So I don't know if there is any other question. And if that was clear. Are the rash localized or does it spread through the body? The biggest problem is that the rashes are most of the time localized, but they can be itchy. And when they itch, of course, humans tend to scratch, and we do not always wash our hands. So it can spread out in the body, and it all depends how where it goes. It's very, very critical when it goes to the eye. And that's it can leave it can cause blindness, so it's very bad. But yeah, so usually it's localized, but it could spread. How long is isolation? Isolation for monkeypox is since you think that was monkeypox, you should stay out and try to go and test. And if the test is positive, the isolation will end when all the lesions that that the person has on the body crust and fall, and you can see the new skin under that. So even it's not like the chicken pox, and that's why it's very important to remember. When in the chicken pox, the first lesion crusts, the person is not contagious anymore, respiratory anymore, and they can cover their rash and go places. But in monkeypox, it's not. You need to wait until you have new skin, even if you have one. And now there comes the coverage. Sometimes people, if only have one, and it's in a place that is under your clothes, it's gonna be okay. But if it is in the hands or it's in the mouth, it's asked to be covered or wait. So until all the skin comes back clear and all the crusts are out. Come on. More questions.
I saw
More
a hand
questions.
go up from Rachel and then it went back down. So I just want to give Rachel a second opportunity to ask a question if she has one.
Yeah, Rachel. The hand is up again.
Hi, there's a couple of us here. We're just wondering about the rising hand, foot, and mouth that we've seen recently. I'm just curious, like your opinion, and should we be doing anything differently besides just our typical cleaning?
Oh, yeah, there is a lot of circulation of that is a Coxsackie virus, and it can give people. It's very transmissible. It's not really bad, but it's very transmissible. And the problem is that because the kids got it in their mouth, then they can have herpangina, and it's a problem for them to be eating. So I will say that I always trust my boots on ground nurses that help there, that you know what to do. Maybe taking a little bit more precautions because it's really circulating. We have seen more cases. And the other thing that we have seen more cases is in pertussis, the whooping cough. So for a school perspective, the Coxsackie, the foot, mouth, and hand, foot, and mouth, just the cleaning that you're doing, those are viruses that will. COVID was like make our cleaning like up here. If you're doing everything that you used to do for COVID, you're kind of killing all the rest of the virus, including monkeypox, as long as you follow the rules and the labels. Being really observant on kids, the foot, mouth, and hand, foot, mouth, it's usually seen in the preschool, less than 5 years old, but you can see it in less than 10. The teachers can get it, adults can get it if you didn't get it before. And So cleaning, washing hands, the same thing that we reinforce with COVID stuff. And now that I said something about the pertussis, if the teachers have not had a pertussis vaccination, at least in the last 10 years, it will be good when you become older. It's better to keep getting your pertussis up to every 10 years. So, and also it's good for the ones that have babies around, that they are protected with the pertussis every 10 years. Is this skin that falls off from monkeypox something that spreads monkeypox? The crusts that fall off, we don't want them to lose the skin, but the crust, it's could still be contagious. Yes, yes. So that's why we try them to have it covered, because when it's crusted and you have it with a Band-Aid, for example, the crust would stay there. Research for cleaning guidelines. Oh, super. Yeah. Thank you, Matt.
All right, I think we have time for one more question. So Kathy, if you want to ask your question.
Yeah, hi. It wasn't so much a question. The cleaning guidelines are good. The other thing I was going to maybe recommend is, particularly like in preschool and lower grades, is when COVID first started, everybody had their own manipulables and there was no sharing of those items. And if that's not still in place, if you're having problems, you may want to look to going back to that, because little kids tend to share those little counting blocks and all those little things that are utilized and immediately put them in their mouth and then hand them to their friend who puts them in their mouth. So it might be something to just see if that's still in place in those classrooms, because that's sometimes something that's kind of slips through the cracks while we're cleaning everything.
Yeah, for sure. Toys are really complicated when we talk about hand, foot, and mouth and rotavirus. Rachel still has the hand on. Well, the last thing maybe I could share, Matt, is that I'm preparing a presentation about rashes, skin rashes, that will include kind of everything, a little bit of photos. So far, I'm trying to simplify it because it ends being confused even for me, because you know that everything looks like everything. But I'm working on that, and I hope tomorrow it's going to be the first time that I'm going to present it, and after the feedback, I will be able to maybe tailor it better. So talk with Matt if you would like to coordinate for your school district a presentation it's like common rashes in children. And he will let me know and coordinate.
Yes, we're excited for that presentation. And if anyone has additional resources or things like that would be useful and beneficial, let us know. We're always happy to put stuff together to help educate and inform, whether it's for staff or parents or the students themselves. So that is our time. I know if others still have questions, you can put them in the chat. Usually we monitor the chat for a few minutes after the call, or you can always just email those questions to us and we'll do our best to get those answered promptly. So with that, I would like to thank everyone for joining us today, especially thanks to Mariana for joining the call. We hope to see you again to give us continued updates around monkeypox. But I hope everyone has a wonderful rest of the week, and we'll see you next Thursday.
Bye.
Thanks.